Welcome back to the Caribou Data Science channel. I'm getting ready to run the COVID-19 daily report for the United States. Just before I get started, a couple notes. First of all, the data used for this report comes from the European Center for Disease Prevention and Control. I'm using the R programming language along with the SQLite database to store my data. Uh, Also, if you haven't done so already, please click the red S button at the bottom right-hand corner of the screen and subscribe to the Caribou Data Science channel. And also, don't forget to like and share this report if you find it useful. All comments and questions can of course, be posted to the comment section below. So let's just go ahead and run the report for the U.S. and see what the numbers actually tell us. Okay, for the U.S., we're currently averaging 28,429 cases per day, but only 811 or 812 deaths. So let's just take a look at the mortality rate for the U.S. As you can see here, the average is about. Obviously, the problem is this here. Okay, it's this spike in April had a huge impact on the numbers. So if that's 5, this is 2.5. So this is about 2.75 maybe, and you can see since about July, the mortality rate has been below, has either been at or below this number here. Okay, so now let's take a look at the daily cases. You can see the daily cases. Well, it looks like you can see a little bit of a curve here, right? But then again, it seems to drop back down here. But still, the 14 moving average reached about 60,000 back in July. Actually, I think it's like July 25th or something like that. Then it began this long steep decline, and now maybe we're going to see another decline here. Okay, so let's take a look at deaths. Well, this is extremely good news. Look at this. The deaths have been declining since this point here. The trend has still been down. Okay, we had some spikes, but the trend is clearly down in deaths to the point we're having less than 1,000 deaths. Again, no deaths are good, but still, we're seeing, despite the spike in cases, we're still seeing a decline in deaths. Okay, let's take a look at the cases since June. Okay, well, we got a little upturn here. That's fine. An upturn followed by a trend downward again. So this remains to be seen exactly what's really going on. Let's take a look at deaths. Well, there's a slight level. You can see we still have a downward trend in deaths as of the first 2 days of October. It's June. Okay. Once again, this number here, the red line, is the average number of cases per week. So the average number of cases per week is about just above 250,000. All right. Now these numbers here are above that, so that's not good. But these numbers here are dropping back down to close to the average. Deaths, once again, this is the average deaths per week. Okay, and look at this: 1, 2, 3, 4, 5, 6, 7 deaths for the last 7 weeks have fallen below the average. Okay. Okay, let's see. Okay, let's take a look at U.S. cases by month. You can see that September's months finish below August months, even taking into account the extra day in August. Deaths, September deaths were below August deaths, even taking into account that August has an extra day. Interesting enough, a 14-day moving average versus a 30-day moving average. I'm not sure how to interpret that in relation to the COVID-19, but nonetheless, it's just another way of looking at the data. Okay, so this takes care of the United States numbers. Okay, okay. So that concludes our reports for the United States. I would say the report for the United States is still good. Okay, because we saw declining cases by week and by month. We saw declining deaths by week and by month. We saw declining deaths by by week. Okay. Okay. So thanks so much for spending time. And once again, if you haven't done so already, please click the red X button, subscribe to the Caribou Data Science channel, share the Caribou Data Science channel with your friends, and also if this video has been helpful and been encouraging, uh, please like and share the video. We'll catch you later on today with some more reports.